Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined by Zadok Nampala, an independent, licensed, experienced, and dedicated therapist with a master's degree in social work and a bachelor's degree in psychology. He has recent experience using his fluent Spanish to help NAFTA beneficiaries from Canada and Mexico and other parts of the world transition to working in the United States. Z also provides medical consultation for Swahili and tribal Africans in the United States. He has proven success teaching in face-to-face and virtual classrooms as a college instructor. Like many naturalized Americans, he has a deep love for this country and a passion for its social challenges, as reflected by his work with the ACLU and the Civil Rights Commission. So we'll have Zadok Z join us again. How are you?
Good. It's good to be here today. I really appreciate another opportunity to be part of this wonderful episodes that you guys are holding here at NorthPoint to help our community.
Absolutely. Thank you for joining us. We are here to talk about a very somber subject. We're talking about suicide prevention awareness. We have some questions that we would love for you to answer for us. And starting right away, can you tell us what is suicide?
Yeah, well, Biftu, thank you so much. And like you said, this is a somber topic, and this is a topic that it's tabooed in many communities, especially immigrant communities, and many people in our communities also. It's not a fun topic to talk about, but it's something that needs to be addressed. We're seeing a lot of trends that are not very pleasant with regards to suicide. Suicide essentially just means ending your own life. It also entails when somebody really, people may be experiencing some form of pain, and they decide the only way to escape this pain is to take their own life. And when somebody dies by suicide or is successful, we say they died by suicide. We're trying to move away from using the term committed suicide because a lot of times people do not commit suicide, they die by suicide. And so basically that's a definition of suicide in a nutshell.
Thank you. Tell us who is at risk for suicide.
Yeah, so most people have risk factors that at one point in their life, they depending on the situation surrounding them, people with chronic pain, people who have a history of trauma in their families, people who have been exposed to violence, including physical, sexual abuse, presence of guns in a home. We do also know that people who are ex-militaries, people who have served, who have PTSD, might experience that. Indirect or direct exposure to other suicidal behavior, such as members or peers or members of your family or peers committing suicide, might also be putting you at risk. These are some of the risk groups that we do have, but the list is endless. Suicide happens sometimes completely unexpected. There's people who, you wake up one day, they were not in the radar, they were not even in the suicide risk watch, but end up committing or dying by suicide. And so the risk factors that I just mentioned, or the people at risk, is not a conclusive list. But those are just some of the few risk groups that we have with regard to suicide.
Thank you. And tell us maybe signs or what it looks like when someone is considering suicide.
Yeah. When somebody's considering suicide, there's a few things that there's some telltale signs that you might look at as a layman, and also special, people like us who are therapists and mental health providers, we have some telltale signs that we look for. But for you, if somebody is talking about wanting to die or wanting to kill themselves, that's a telltale sign. If somebody talks about feeling empty, hopeless, and they have no reason to live, that's another sign. If somebody's talking, feeling a sense of being a burden to other people, they keep saying that, then that right there is somebody who might be considering suicide. Um, Sometimes you might see people do physical things like giving away the important stuff that they have, giving away their possessions, um, taking great risks. Sometimes people become, we all take risks. I do take risks every day, but I'm not reckless. So sometimes you find people being reckless, driving extremely fast, or doing things that could potentially put them at risk of death. This could be signs that somebody is at risk of committing of dying by suicide, and so or maybe sometimes they withdraw from family. They shut down abruptly. They don't talk to anybody. You want to be able to watch on those two and realize that this could be also a telltale sign that somebody is thinking about suicide. And we see the numbers. They're becoming more and more clear that when you see these signs, they correlate with suicide. And so it's very important to pay attention to such when it happens. And like I said, people who have chronic pain, people who are abused, people, these people who already have these factors that are counting against them, they're people who you want to also watch to see when these things start happening. And then you know that they might be in danger of suicide.
Thank you. So if we do come across or know someone displaying those signs or telltale signs, like you said, how would you advise us to talk to them?
Okay. This is very hard, Biftu. This is one of the very tough topics to talk about. It's not easy, even as a therapist, talking to somebody about suicide. And some people out there, there's some false analogies that when you talk to people about suicide, you planted that seed in them and that they may end up committing suicide. That's not true. That's not true at all. I think people need to understand that talking about suicide directly and addressing it is very, very important. When you come to me as an individual, I'll ask you these questions. As a matter of fact, when I'm doing the intake procedure, I ask these questions. It's called risk assessment, and I ask you directly, do you have thoughts of ending your life? Have you ever thought about ending your life? Have you ever done anything that would jeopardize or end your life? Very direct questions. And so, as somebody who has a beloved one, it's important to directly address these questions, and really talk about it through and ask following questions and follow-up questions to really inquire some more if the individual you're talking to is considering dying by suicide. And so just asking him directly and just saying, are you thinking of killing yourself? This can be the best way of identifying someone at risk. And there's no shortcut. There's no hiding. I think this is something that we need to understand. We have to address it head on. If we don't, then we're going to lose the people that we're talking to. If we try to beat around the bush, it's not going to work. The impact is very negative. So let's try to talk about it directly and address it head on.
Absolutely. And then for those people who are in crisis or who are having suicidal thoughts, what should they do?
Yeah, so people who are having suicidal thoughts, just try to get them through the day. I think rather than focusing on the future, try to get them through the day. Try to find something that can help them see a day and just have some strength to go through the day and finish one day at a time. I think talking about how one's feeling and how someone's, to trust their emotions and also helping them find support lines, because there's hotlines that help people. And so once you talk to somebody and stabilize them, because if somebody's planning to die by suicide or considering suicide, that's a very high risk, and we need to act, because every second counts. And so if they say, for example, if they have a plan, we need to know what the plan is, and then try to help connect them with resources. You have to contact a healthcare professional or a mental health service team. We do have the numbers. We talk about these numbers every day. They were 1-800 number, 1-800 273 talk, or you can also text 741 after you recognize that somebody is considering suicide. But the first thing is how you react to them. You can save a life by how you react. And so just talking to them and just letting them know that somebody's there and somebody thinks about them is very important as you spontaneously consider calling the hotline and having them reach out for help too.
Absolutely. Yeah. Those numbers are widely shared for a reason. And that's because that's their job to help people through those moments. So thank you for sharing. So let's talk about certain groups. So we talked about who's at risk, but maybe give us some examples of certain groups that do have higher rates of suicide.
Yeah, definitely. Thank you so much for that. And just a follow up to those numbers that I've
Sure.
given you. If you call those numbers, they have languages, different languages.
Mhm.
Because sometimes language could be a barrier
Yeah.
to people. They have them in
Mhm.
Spanish, they have them in Arabic, French, whichever language you choose or that works for you. They have those languages in there too for
Yeah.
helping people prevent suicide. When we do talk about the risk groups, according to the CDC, and we've known this for a very long time, me being in this profession for about 19
Mhm.
years, women are more likely to attempt suicide than men, but men
Mhm.
are more likely to die by suicide than women. You ask
Mhm.
you ask why. It's clear that men uh, tend to use more lethal attempts. Like using a
Mhm.
firearm, um, or suffocation. But for example, by hanging themselves. And women are more likely to attempt suicide by poisoning themselves.
Mhm.
However, recent data are beginning to show something a little different. That shifting, women are shifting towards more lethal
Mhm.
ways of taking their lives. And so
Mhm.
the CDC data shows that um, the rates are going higher, and also rates are going higher by ethnicity, gender, not only gender, but also by ethnicity, and also um, socioeconomic status. So we find out that American Indian and Alaska Native men have the highest rate of suicide in the United States, followed by Hispanic and then white males. And so these are the groups that we see that are at very high risk, and that then they tend to be more successful in taking their lives. And then suicide ranks the second leading cause of death recently um, in youth among us from age of 10 to 14. And this is a very sad statistic because we see that our children in recent researches, we see like 12-year-old children, especially black children, have the highest rate of suicide than white children. And so the trends are moving in a very wanting place. Like the amount of lives that we lose at the age when you're 12, when you're 10, you haven't even really started living your life, and losing a child at that age to suicide is a very painful experience for the families left behind. And we're seeing this trend. And we're trying to, there's a lot of studies going on, and there's a lot of bullying, and these days having
Mhm.
social network and the internet and body imaging. Um, a lot of our kids are exposed to things that they shouldn't be exposed to at a very young age, and they have to deal with some very painful consequences of other people's choices of words, very hurtful things said, and they don't know how to deal with that, and so they end up ending their lives. And so these are the statistics that we have. They're not pleasing statistics. The numbers are not getting down. They're not going flat. They're going high. And it tells you that there's a lot that we need to done with regards to suicide. If we start seeing 10-year-olds, 12-year-olds, 14-year-olds committing suicide or dying by suicide, um, it really means that there's a lot that needs to be addressed. And what are we doing as a society to reverse these numbers?
Absolutely. Um, let's talk about treatment options and therapies and what's available.
Yeah. So there's different kinds of therapies that are available. So when you call those numbers, those are they do what we call a risk assessment, and so they do a
Mhm.
quick risk assessment, and they help you. But that's like the immediate before you go to the hospital, you get committed, or after the fact. So like after you attempted suicide and you're not successful, what else do they do to help you? And so there's cognitive behavioral therapy, and this is a psychotherapy that can help people learn a way to deal with their stressful experiences. And then there's brief intervention strategies. These are research based, and they help people plan their you know plan on crisis before they happen, and so they're kind of proactive um, to when they find themselves in crisis, and there's specific instructions on how to help them go through process the suicidal thoughts. So this is like this brief strategy intervention, and then there is dialectical behavioral therapy. So that's also called DBT, and this is a type of psychotherapy that has been shown to reduce suicidal behaviors in adolescents. It's also helps with personality disorders and also help adults with borderline behaviors. And so that's another form of therapy that is used. And then there's also collaborative care. So collaborative care is a care that team-based. It's a team-based effort, and so you're talking to a pediatrics, you're talking to a therapist, you're talking to a social worker. All these individuals come together in order to assist somebody who's experiencing a suicidal crisis, and so that's another form of care, form of help that's available out there for people experiencing suicidal thoughts. At the end of the day, the community is what really counts. We have to come together to help individuals. The immediate support that they have, family, friends, schools, and all that. Those are the people who come in first to help them. And so, if we are able to come together as a community, we can save a life. And also, that will be the best and the long-term impact on avoiding any suicidal behaviors.
Yeah, absolutely. Thank you. And that leads to my next question, which is this idea of prevention. So it's a little bit open-ended, but what does it look like when we talk about suicide prevention?
Yeah. So, Biftu, we have to understand that suicide is a serious public health problem, right? And this is a problem that causes long-lasting harmful impacts on individual families and communities. And so, therefore, there are things that we can do for suicide prevention. There are things that we can do to help reduce these factors that increase the risk of suicide. And so, basically, when you talk about suicide prevention, we're talking about us coming together and solving this public health crisis that we're experiencing, coming together as a community and creating platforms like this where we can normalize talk about suicide, where we can come together and have moments to contemplate and think about the people who have died by suicide and talk about them, and talk to families about the risks that they are, because the risk factors includes, like I said before, Biftu, if you had family members who've committed suicide, then you want to be careful and also be proactive, because chances are that there are higher chances that somebody is in a higher risk category. If there's a family member, if you have been experiencing trauma in any form, shape, if you have had post-traumatic stress disorders and symptoms of this nature, you are at a risk, and you should consider really being proactive. And so, coming together and reminding people to think about this and reminding people to talk about this will help us understand or reduce risk factors associated with suicide. And that's basically what suicide prevention is. That's why we have this Suicide Awareness Month, where we're talking about suicide and helping people and communities realize resources that are available and how to harness those the strength that we have within resources and within communities to really help people who are struggling. When you are going through pain, sometimes you feel like you are the only person going through that pain. But if you realize that you have that shared pain, like we are as a community, we are one, it's much easier for somebody to seek for help and talk to somebody about what they're experiencing. So when we talk about suicide prevention, we're talking about coming together. We're talking about all those things that I've mentioned in order to reduce suicide risks in our communities and even in our nation. And this is a trend that's is even worldwide. We're seeing trends in communities that we haven't seen before. I'm from Kenya, and We're seeing suicide rates going high in Kenya too. Teachers, farmers, it's, there's economical hardships that sometimes make
Mm.
people feel like they have no other choice.
Yeah,
Mhm.
absolutely. Um, so we always want to talk about social determinants of health. What other disparities do you see reflected in the rates of suicide? Um,
Yes,
yeah.
that's a very, very good question. So when we talk about the social determinants of health,
Mhm.
we really come to people who are disadvantaged. We come to people
Mhm.
who l- let's talk about veterans.
Mhm.
Veterans
Yeah.
are ones of the the highest affected population when it comes to suicide, because
Mhm.
veterans, they come up with a lot of PTSD. They come up with a lot of other issues that make them alienated from the mainstream
Mhm.
community. You see that there's a very high number of veterans who are homeless. This shouldn't be the case, but it is the case. And so veterans have been alienated. We have people who live in rural places.
Mhm.
I don't know if you've heard about this, but the suicide rate among its farmers has steadily continued just to go high here in the United States. And so, rural areas, there's not a whole lot of resources, and people out there by themselves. They have farm machinery, they have hunting tools, and all that. And so, it's very easy for somebody to access means to end their life. Um, let's talk about people who are sexual gender minorities. You know, um,
Mhm.
and these are the communities of people that also have been impacted greatly by suicide because of lack of access to services and support. Unfortunately, there's a lot of things that are happening that they're sending us backwards with the progress that we've made in a long time. And so I really think it's time we talk about this more, because there's going to be more and more people who feel the need, that they're left out and feel like they don't have anywhere to go to. Um, the tribal populations, tribal
Mhm.
populations, these are disproportionately experience factors linked to suicide, such as substance abuse, substance misuse, financial problems, relationship problems, physical health, mental health. There's a lot of things that are affecting people in reservations, and if you go to uh, in places like minorities, inner cities, is quite a bit of violence happening, and this also can lead to people um, thinking a lot about suicide. And so these are some of the risk factors that we're thinking about. These are some of the risk factors that are impacting the rate of suicide in these communities. Um, we have to really consider these populations when when we're talking about suicide, and know
Mhm.
how can we, as a society, really find ways um, to bring services and resources to these communities, because it didn't begin yesterday, Biftu. This has been going on for a very long time, and I
Yeah.
think people understanding this and knowing that the pain that these families, these communities are carrying when one person dies by suicide, it's very hard. And so if people can understand that, then we can start channeling resources and coming in and helping these communities in ways that can help reduce these healthcare disparities.
Absolutely.
Hmm.
Thank you. So, what services do we have at NorthPoint to help?
Yeah, I thought you'd ask. Here at North Point, we do have behavioral health department.
Hmm.
That's where we start. Well, sometimes it starts even with medical. Sometimes it starts in dentistry. When
Hmm.
you come to North Point, it's a one-stop shop. We do offer um, crisis services. So when you come in as a crisis client, we will see you and we'll do a risk assessment if you're experiencing crisis, and then we'll go from there and think about other ways that we can provide you support. And so the get point is just to come in and call North Point. We have our number right there, 612-543-2500. Or if you're experiencing a crisis, just walk in. We welcome walk-ins when it comes to crises, and we have people at hand at all times to support anybody who is experiencing suicidal crisis. In addition to that, when you come to North Point, we will have continuing services. So essentially, after we see you, we do a risk assessment. We will determine what services you need. And if you need a higher level of service, then we do a referral and we will send you where you need to go and the services you need to get. We are very well connected with the community, and there's other agencies that we partner with that provide services to help you with your crisis. And so we would refer you, and then for continuing services, you can come back and see a therapist at NorthPoint, and this therapist will continue seeing you for the duration of time that you would see. So we do have people who are very highly trained in trauma and crisis management, and so we're lucky to be in this community. I am so privileged to be serving this community and providing services at a school, and I'm working with a lot of students here to help them really understand that the risks that surround them. So those are the services that we do provide at NorthPoint, and we continue offering these services to our community members of all ages.
Wonderful. Thank you.
Mhm.
Well, that is everything that we wanted to talk about. So we are here again with Zadok Nampala. We're talking about suicide prevention awareness. Thank you. Yeah.
Appreciate it. Thank you so much for having me on.
Thank you for listening to NorthPoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know the times get hard.